Organ trafficking remains a pervasive issue and is centered on human vulnerability and desperation. The destitute predominate the black market organ supply. The World Health Organization estimates over 10,000 organs are exchanged on the black market annually, more than one every hour. Revenue from illicit organ trade is estimated to be upwards of $1.7 billion annually, and the retail price for a kidney is 75 to 100,000 US dollars, and much more for other transplantable organs. Middlemen benefit from the proceeds, while the financially desperate donor typically receives only a few $1,000s while risking personal harm and even death. The Declaration of Istanbul provides the ethical guidelines for organ donation and transplantation and condemns transplant tourism and trafficking. Over 100 nations have endorsed these principles. The Pontifical Academy of Sciences calls the practice true crimes against humanity that need to be recognized as such by all religious, political, and social leaders, and by national and international legislation. There is a strong need for national governments, regulatory authorities, and healthcare institutions to develop policies that put an end to commerce in human organs. There continues to be a low rate of law enforcement despite broad multinational support for these positions, and demand for organs remains high. The COVID pandemic is further driving financial hardship, and utilization of cryptocurrency will only make it more difficult to track illicit monetary movement, helping shield the system, especially for organ brokers and various middlemen. We commend the work of the Council of Europe and the Convention Against Trafficking in Human Organs, yet to date fewer than 15 nations have ratified this pact, which functions as a legal instrument and makes organ trafficking a criminal offense. By ratifying this convention, member states show their commitment to preventing and combating these crimes that are an affront to basic human rights. We encourage member states to establish systems that will promote ethical and transplant options while supporting living donors through safety and transparency, while establishing systems to discourage illicit transplants and human trafficking. The world community must educate transplant candidates and discourage patients from seeking illicit donors or participating in transplant tourism. We all must do our part to help reduce and ultimately eliminate this heinous form of human trafficking.